Hello, I'm Phil Newbold, President and CEO of Memorial Hospital and Health System. You know, with the new healthcare reform legislation, people might ask, what's Memorial trying to do to get ready for that? Well, I'm going to talk a little bit about the kind of care that we want to deliver under a healthcare reform environment. And a good way to think about the care that's going to have to be delivered is with the acronym ICE, I-C-E. And they stand for three important concepts that I'd like to talk a little bit about. The first I is about integrated care. The care should be integrated, meaning we should be in alignment between all the providers so that we have the same incentives to not just do more, but do the best practice possible. And so integration generally will mean that you'll see more of hospitals and doctors getting together, often through employment or alignment, as we often call it, in one single organization so that we can deliver the kinds of care that is very integrated, no matter whether people are just leaving their homes or whether they're at work sites, or whether they're in school, whether they're looking for urgent care, whether they're looking for diagnostic and outpatient care, all the way through the hospital experience, and then afterwards where we're rehabilitating or doing follow-up and going back for our physicians for follow-up care or maybe rehab, and then all the way back to their home. So all of that care needs to be integrated. It needs to have good alignment, and that's the first part of it. The C of ICE, I-C-E, stands for all of that needs to be coordinated. So as you move from one site of care to another, as you move from one provider to another, or you're transitioning anywhere along the continuum or progression of care, that needs to be all coordinated so that we have people that know they're in the best set of hands, and wherever they end up, there's an electronic medical record helping them follow so there's no duplication. So people are aware of all of the underlying conditions, what's happened before, what the prognosis may be, diagnosis, and so on. And so that will really help to coordinate the care and get it to the appropriate level. For some kinds of illnesses, acute illnesses really, we may be much better off in an urgent care type of setting than, say, an emergency room setting. And for chronic care, we may be very much better in locations that are dealing in groups with diabetics or congestive heart failure or asthmatic patients and so on. So we're going to have to coordinate all this care if it's really going to be effective. The last part of our acronym, E, means it's got to be evidence-based. Evidence-based means there are some better ways to practice than others. Instead of letting everybody sort of do their own thing in medicine with different outcomes and different services and lengths of stay and ways of treatment, we're going to be moving as a country towards what appears in the journals as the best way to treat or to take care of an illness or to do a procedure. And evidence-based means we're not going to have all this variation across the country. We're going to practice the best, most effective, most efficient style of medicine. And so there you have it for care, ICE. Integrated, meaning a very much alignment between all the providers, everybody with a common set of objectives. C, meaning it's very coordinated, so people talk together, they use a common electronic medical record. And E means it's evidence-based, that there are best ways to practice medicine and deliver them so that we can be sure that all of the patients have the highest level of care in the most appropriate setting with the best outcome. So when you think about the care that may be delivered under healthcare reform, think about that acronym ICE, and you'll see Memorial right at the forefront, making sure that we are prepared and well ahead as we deliver the kind of care that's going to be really required in a post-healthcare reform environment.